All right. So, yeah, this is just a quick, like, 15 to 20-minute interview that I got to do for my class. It's just to kind of learn about the different career options you have as a kinesiology major, like what different fields they actually do.
Okay,
So, I just got some questions about, like, work and about school for you. So,
sure.
I'll start off with what is your name and current occupation?
My name is Jenny Michelik. The last name is spelled M as in Mary, Aciolek. I work as a physical therapist in an outpatient clinic.
Okay, and where'd you go to school for that?
I went to Marquette University and I graduated with a bachelor's degree in PT in 1991.
Okay, and why did you choose to go into that specific field?
I knew I wanted to do healthcare and I wanted to help people like restore function. Like I wanted to tell people what they could do versus what they couldn't do. And so I liked the flexibility in different areas you could get into because I wasn't quite sure which area. So I thought it provided a lot of options.
Okay, so you were kind of like set, you knew what you kind of want to do
Oh
coming into
yeah,
college. Okay.
that I knew in high school for sure. So back when I, uh, was in high school, there were only three schools that had PT, and Marquette was the only direct admit. So that's why I went to Marquette.
Oh, okay. And where you from?
I grew up in the Fox Valley. I grew up in Menasha.
Oh, okay. What were kind of like the challenges of that course, like going through school as a PT?
I mean, it was tough. It was really hard, and I knew it would be hard. That's why I went with the direct admit. Um, so that means you're accepted as a freshman. Um, and yeah, it was just really, really grueling, really hard. The semesters were packed full. We had anywhere between 18 and 24 credits a semester. Um, yeah, that's why they ended up making it with the masters. They kind of spread it out a little bit.
Okay, yeah, 24 credits a semester. That's a lot to handle.
Yeah, I think that was only one, but it was, and some of it was, it was hard. It was hard for sure. So trying to manage time, and I was a student that had to work hard for their grades. It didn't come real natural, so I really put a lot of time in the library and a lot of studying, a lot of, and then I struggled because I didn't have a lot of rehab experience. Like I didn't have a lot of great interpersonal skills.
Uh-huh.
So that for me was hard too when I started my clinicals. Um, Trying to put it all together was really hard for me at first. Um, but, with the clinicals were key. Practicing it and being in a safe learning environment with good professionals helps the most for sure.
Yeah, and what are some of the different career paths you could have gone with the PT degree?
I mean, I guess you could have done some, management kind of things, or even insurance claims and review. But really, the different areas of PT, like hospitals, inpatient rehab, wound care, pediatrics. So within PT itself, it offered a lot of specialization.
Okay, yeah. And what does like a day-to-day look like for your job?
So you get to the clinic and yeah, just one patient after the other. We are allowed 45 minutes with each patient, no matter if it's a new person or a repeat patient. If it's a chronic problem, if it's real acute, surgical, non-surgical, everybody gets 45 minutes. So and that's when you got to complete your documentation too, and that's been pretty challenging because there is so much documentation now required with different insurances and providers, and to keep up quality and productivity. There's a lot of extra like that I don't don't care for anymore. Certain insurances
Yeah.
want paperwork, extra paperwork, and that all takes time. And, for me, I want to spend the time with my patients, not in front of the computer. So that's what I struggle with is stay timely, and to stay current. It's hard to, look at research articles and all of that at work. We used to do it at work. We'd have study groups. And,
Yeah.
now it's like you go in and you are running from the minute you walk in till about an hour after you're supposed to leave. So it's pretty challenging.
Yeah.
But it's good. I mean, like I said, I love the job. I love the patients. That part of it that's why I still do it. Very rewarding.
Yeah, one of my questions was actually going to be your favorite and least favorite part, but I feel like I got...
I made it real clear.
Yeah.
No, the patient connection, like, that for me is just huge and why I'll always stay and why I've stayed in PT. Learning how to help people, and you learn from your patients as much as you help them. They kind of help guide you. And you see all walks of life, and it's very, very fulfilling.
Yeah, that's kind of what Emily said too, that her favorite part was seeing all the different patients and being able to help them and see them progress throughout your time helping them.
Right. So it's a great career. I don't know if you're looking into it at all, but I love PT. I really do.
How many patients do you say you would see on like a typical day?
It depends on the day. So I work 2 10s and 2 5s, and you treat patients every 45 minutes. A new patient different patient every 45 minutes. So
Okay, yeah.
that math works out too, but so there's no extra time. Maybe once in a while you'll have a meeting, but those are few and far between.
Yeah. So, and then with the work hours, you said you work 2 10s and then 2 5s?
Yep.
Okay, so is that just 3 days a week, or like what does your typical like week look like?
Yes, I work Monday through Thursday, Monday, Wednesday, 7 to 5:30 is what I'm scheduled, and Tuesday, Thursday, 7:30 to 12:30. Again, you never get out on time, though. Never.
Yeah. And did you take any like after you completed your degree, did you have to do any extra training before you could become a physical therapist?
No, I had to pass a licensure exam, and once I passed that, I could be a practicing PT. Now, our licenses also require a certain, I think it's 30 hours every 2 years of continuing education. I would say early in my career, I had way more than that. Like, you couldn't get enough. There's just so much to learn.
Yeah.
And now that I've been doing it, now it's a little harder to, get those 30 hours in. But, you take classes, and you're always learning. You're learning from your peers, and so those are the requirements. I think it's 30 hours every 2 years.
Okay, and did you get a lot of like hands-on experience throughout your college? Like, did you do, I don't know how I would say.
Not a ton. I mean, we practice on each other, of course, and we had labs and that sort of thing, but clinicals, we had, I think we had a 2-week one, a 4-week one, and then 3, our senior year, second semester was 3 6-week internships at various sites.
Okay.
That's where you learn it. So you learn all the book work, but and that's what I was saying. I struggled to then apply it and put it all together with patients, and that's where your clinicals come in. And your mentors when you're a new grad, that's where you really kind of learn it. Yeah,
so you would say that like the actual hands-on experience is probably a little better than the school?
Well, you need both, you need both. And so you got to have the book work as your basis. You have to have your clinical reasoning, but then to apply it, that's where the clinicals were the most helpful. But if you don't have the book work to have any clinical reasoning, then, you're not a PT,
Yeah.
So you need both. You definitely need both. And that was my disappointment when they went to master's and doctorate degrees. They didn't expand a lot on the hands-on the clinicals. It's more book work and not less clinicals, but not a lot more, which is what I was kind of hoping for when they were, toying and increasing the requirement for PT school.
Yeah. So if you could like start everything over, you could redo your entire college, would you take the same path you did now, or would you?
100%, yes, 100%. I'm so grateful I knew what I wanted and was able to, get into what I wanted right away. There were only 3 schools, so there was probably, there's probably 200 positions open for PT school per year. So I was really blessed to get in and be able to start doing it right away.
Yeah, and it seems like a lot more schools now have that kind of option to.
Yeah, absolutely. There's much more opportunity, many more schools. So that's good. And we're still, I don't think the market is saturated. We're always still looking for help. So.
Yeah, that's what I actually kind of one of my questions. It was like, what does the future look like for your field?
As we age, and I just think it's going to continue to expand. We already are seeing expansions in like virtual health, virtual visits, rather than always coming in. I just see more and more opportunities. And now, if you want to go the insurance route and work as kind of like an adjuster kind of type of, you could do that as well.
Okay, yeah.
Like a review, a utilization review, quality review.
Have you had any different jobs other than the one you hold right now?
I've always been a PT, but just at just 2 different companies, but different areas because, I work for Aurora now. So I was down at West Allis and New Berlin, and now I'm in West Bend.
Okay, yeah, that's West Bend. I'm from Kewaskum, that's how I kind of knew Emily, because she was the trainer for the high school.
Sure.
What advice would you have for a student that's pursuing this career?
Go to class. learn as much as you can, and when you have your first job, make sure you have some kind of mentoring, some kind of, you're not on your own, that you work with other people, because you learn a lot by working with other therapists. And then you learn about what is OT, what is speech, how do orthopedic doctors work, go out to surgery, work on the floor with the RN. Like, the more diverse you can be, especially at first, the better you are in the long run.
Okay, yeah. So it seems like it's a field where you're kind of like talking to people all the time, and it's.
You sure are.
Do you like? Were you always a people person? Is that kind of?
No, which is why I struggled. I was definitely not a people person. Not at all. Very quiet and reserved, and I was sure of myself, but I didn't really like to be with a lot of other people. But now that, I love it. When I don't do it, I was off on, I was off for an extended time with my kids. I got my kids. And I really, really missed it. Like, a lot of what I really like being with people and learning about different people and their lives and that sort of thing. So, I'm totally a people person.
Yeah. Well, that kind of looks like all my questions I had for you today.
Perfect. Are you thinking about getting into PT, or are you just exploring a lot of different options?
I'm just kind of exploring a lot of different options. That's kind of what these interviews are for, so you can talk to different people who have been through different fields and kind of just, better understand it for yourself, so you maybe help you decide what you want to do.
And, the one interesting thing I didn't know when I was going through school is, like, there's almost I don't know if it's hierarchy, but there's a level of respect that PTs get I wasn't expecting. So PTs are very much respected by a lot of physicians, nurses, more so than, like, Emily is an AT. Like, our insurances don't even allow them to bill. Like, it's just not as respected, you know what I mean? And
Yeah.
their job is equally as important, but, yeah, there definitely tends to be a little bit more of a hierarchy, and I'm not really quite sure why.
Yeah. Well, thank you so much for talking to me today.
Yeah, you bet. And if you have questions that aren't for the class, like, a PA or an NP, what would you do? Or,
Okay.
feel free to reach out. I'd be glad to talk to you. Or if you need a clinical rotation somewhere, you want to observe, you holler.
Yeah, thank you so much.
You bet. I wish you good luck.
Yeah, thank you.
Thanks.
Bye.